Hi viewer, my name is Ashwini Hapalaidu. Today I would like to have the chance to talking about invasive ductal carcinoma on breast. So before going for my main topic of case study, I want to describe about the basic of breast cancer. Breast cancer is cancer that form in the cell of the breast. After skin cancer, breast cancer is the most common cancer diagnosed in human in the United States. Breast cancer can occur in both men and women, but it's far more common in women. This picture shows the anatomy of the female breast. The left picture shows the normal breast without any cancer cell, while on the right pictures shows a stage 3 breast cancer. Can see there is a cancer cell. The small picture of breast shows changes of breast. So this is my main topic, which is invasive ductal carcinoma. Invasive ductal carcinoma, IDC, sometimes called infiltrating ductal carcinoma, is the most common type of breast cancer. About 80% of all breast cancer are invasive ductal carcinomas. So invasive means that the cancer has invaded or spread to the surrounding breast tissues. Ductal means that the cancer began in the milk ducts, which are the pipes that carry milks from the milk producing lobules to the nipple. Carcinoma refers to any cancer that begins in the skin or other tissues that cover internal organs such as breast. So altogether, invasive ductal carcinoma refers to cancer that has broken through the wall of the milk duct and began to invade the tissues of the breast. Over time, invasive ductal carcinoma can spread to the lymph nodes and possibly to other areas of the body. So the picture shows a cancer cell is from a normal duct until invasive. Just now, as I explained, that invasive is spreading to other cell. So first is normal growth, which is normal duct. Second is ductal hyperplasia, maybe it's a first stage of cancer. There is only can see a few growth of cancer. The third is DCIS, a ductal carcinoma in situ. The cancer cell become more spreading over the duct. The fourth is invasive ductal carcinoma. The cancer cell become more spreading over the duct. And the lining of the gray color is the basement membrane. The red lining is a myoepithelium and the brown is a ductal epithelium. My case study is about a 55 years old female went to hospital for a complaint of right breast swelling while the left breast was in a normal condition. She already taking a normal treatment on the hospital when she having a basic swelling and informed that she taking antibiotics over 1 year. She feels so discomfort and unusual until the swelling become more worse, and lastly a doctor advised her to admitted at hospital for further treatment. Doctor discussed to a biopsy, which record biopsy of right breast to taking a small sample of breast tissue for laboratory testing. The gross discussion shows a multiple strips of whitish tissue measuring 2 to 20 mm in length was submitted. The histopathology, which is a microscopy, revealed that the few strips of tumor tissue composed of tumor cell displaying marked nuclear phlomorhism arranged in anastomosing trabecular and nest. No tubule formation is seen. Brisk mitotic activity is seen. Intertumoral stroma shows desmoplastic response. So from the picture of microscopy, you can see the breast cancer at high magnification. The infiltrating ductal carcinoma of breast as pleomorphic cell infiltrating through the stroma. Note that abundant pink collagen bands from desmoplasia making the tumor to feel more firmer than normal breast tissue on palpation. Interpretations, which is the result of the patient having an invasive carcinoma, which is a type infiltrating ductal carcinoma. It is a high combined grade, grade 3, poorly differentiated. These cancer cells look the most abnormal. They tend to grow and spread more aggressively. So on the pictures, microscopy shows the infiltrating ductal carcinoma, which can you see the mitosis very well. The treatment is, for stage 3 treatment options vary widely and may consist of mastectomy and radiation for local treatment and hormone therapy or chemotherapy for systemic treatment. Nearly every person with a stage 3 diagnosis will do the best with a combination of 2 or more treatments. There are 3 treatments which can take: mastectomy, removal of the whole breast; quadrectomy, removal of 1/4 of the breast; lumpectomy is the removal of a small part of the breast. The additional test can be done is blood. For blood tests, the doctor may also need to do several types of blood tests. These tests may be done before or after surgery. Second, the complete blood count, which is a complete blood count is used to measure the number of different types of cell, such as red blood cell and white blood cell, in a sample of person's blood. It is done to make sure that your bone marrow is functioning well. Blood chemistry. This test evaluates how well your liver and kidneys are working. Hepatitis tests. These tests are occasionally used to check for evidence of prior exposure to hepatitis B or hepatitis C. If you have evidence of an active hepatitis B infection, you may need to take a special medication to suppress the virus before you receive chemotherapy. Without this medication, the chemotherapy can help the virus to grow and cause damage to the liver. Prevention is lifestyle. Women may reduce their risk of breast cancer by maintaining a healthy weight, being physically active. Second, high levels of physical activity reduce the risk of breast cancer by about 14%. Strategies that encourage regular physical activity and reduce obesity could also have other benefits, such as reduced risk of cardiovascular disease and diabetes. Interpretations, which is the result of the patient having an invasive carcinoma, which is a type infiltrating ductal carcinoma. It is a high combined grade, grade 3, poorly differentiated. These cancer cells look the most abnormal. They tend to grow and spread more aggressively. The gross discussion shows the multiple strips of whitish tissue measuring 2 to 20 mm